Parkinson's disease is a neurological disorder in which neurons within the substantia nigra die off. And these neurons provide dopamine to the motor circuits in the brain. And when these neurons are no longer present, the lack of dopamine changes the way the motor circuits work. And this causes several symptoms in patients with Parkinson's disease, which would include slowness in movement, or what we call bradykinesia. And they also get an increase in muscle tone, which is called rigidity, which makes it difficult for them to use their hands, their arms, their legs. And the third part of the sort of classic triad of Parkinson's disease is the tremor that I think people sort of most associate with the disease. Some people will be diagnosed with early onset Parkinson's disease, which is usually patients that are sometimes even in their 40s and early 50s, whereas the average age is more in the mid-60s. And it tends to be sort of gradually progressive over the course of the years. It becomes most difficult to deal with for the patients, and especially their families, is when they've advanced to the point of having dementia. And then that really has a significant impact. There's a couple different things that make our approach to a patient with Parkinson's disease unique here at the Yale Movement Disorder Center. One of them is that we have a very robust movement disorder center here, and our deep brain stimulation center is one of the busiest in the Northeast. So deep brain stimulation is a way to modulate the neural activity in the brain. And using this neuromodulation, we attempt to restore brain circuits back to a more normal function. One patient that I remember in particular that I went to see who had deep brain stimulation done for severe tremor, and her family was standing around her and they were all laughing as she was eating eggs. And I walked in the room and I was saying, "What am I missing? What's so funny here?" And they said she hasn't eaten eggs with a fork in 25 years. And so this was a huge thing for her to be able to use a fork to have breakfast. My name is Jason Gerard. I'm the Director of Stereotactic and Functional Neurosurgery here at Yale.